Welcome everybody back to our series here with Ortho Laser and Moss Wellness. Today we've prepared another session of how we work together to help you improve and manage your pain. So today's focus is our plantar fasciitis, someone that is experiencing that pain. We'll tell you what it is, symptoms to look out for, and then walk you through what a session here with us at Moss Wellness would look like after you've had your session with Ortho Laser. So plantar fasciitis is a very common pain most of our patients and clients show. And so what that is, the plantar fasciitis is a connective tissue that's coming from the heel, and it connects all the way in between this arch, right? All the way to your toe. So think about it as a bowstring, right? That manipulates your feet when you're walking, when you're just putting that heel down to the ground. And so what we offer is you receiving that therapy session with Ortho Laser, where you can get that laser therapy anywhere between here and here. That's something that would be discussed in your sessions. And after you come and you get the massage, and we focus a lot on that calf, because some of those symptoms that you can identify when you have plantar fasciitis would be tight calves. And so that's one of the main reasons we work indirectly with these muscles that are all connected together, right? So if there is overuse and overstress in the heel, it can absolutely cause that blood flow restriction. And then where there are tears in that connective tissue, it won't allow for the proper healing to happen because of this blockage of blood flow. And so what we try to do is, I've said this multiple times, but the calf is the second heart of the body, because a lot of that blood flow travels and then back, right? That deoxygenated blood travels back. So what my job is here is to really get to those muscles that indirectly impact. And so what I'll do is I'll start my clients facing up in that anterior position to work on the shin. So I'm going to be warming up the tissue, which the wonderful thing is of working together with Ortho Laser and Moss Wellness is that they've already started the warming of the tissue before you get here. So I'm going to do a lot of just getting it to be warm, and then letting the nervous system know that I'm just getting in there, and that flow and circulation. Right, and then I'm getting to know and find those trigger points. Once I've identified and I've warmed up the tissue, then I can start digging in, applying some friction. And for my client, I've identified this area right here at the top. So I'm going to apply some neuromuscular therapy, which is about adding 8 to 12 seconds of hold. And I'm going to do this all the way down, 8 to 12 seconds hold. All right. And I'll do that in each point. This is a little bit of a faster pace, but we'll definitely do that maybe 2 to 3 times to get that shin to soften. Once I feel satisfied with that tissue and that muscle, then what I'll do is I'll take my client to get her feet up, and I'm going to start working and warming the gastrocnemius and soleus muscles, which is our calf. Carrying that all the way to the Achilles. And this way I can get the muscles in different planes. That ankle, that Achilles. So when I turn my client over, it's not as painful. This type of work, more of that therapeutic work, sometimes cannot, will not be as enjoyable, but the relief a couple, days after is worth your visit. All right. So once I've worked the calf a little bit, what I'll have Sydney do is turn over so I can focus a lot more on the calf itself. So similar to what I did to the shins, I'm gonna warm it up. Spend some time. Once I feel like I've warmed up both the soleus and the gastrocnemius, then I'm gonna go in with my forearm to add that more of a deep pressure. And so what I'll do here is I'm going to ask my client to breathe in through her nose and out. So whenever you're ready, take a deep breath through the nose, inhale and release through the nose, also carrying that oxygen to the brain. So I'm going to reach all the way here to the popliteal, which is the back of the knee. We don't want to add pressure here. We want to be more gentle, but we do want to reach from the bottom because there are attachments, right? So we want to hit all the way. And if my client didn't have pants and once we're in session, then I would carry it all the way through the hamstring to the gluteal area, okay? But for the sake of the video, we're just doing the calves right now, going down closer to the Achilles, making sure we don't miss the Achilles, right? Release that tightness, giving that oxygen and nutrients to the muscle. Once I've done that, I'm going down directly to the pain, which is right underneath, right? The heel. So I'm going to massage it. You can use some knuckles. Right. Hitting that arch. Nice. So I'll spend a lot of time, or the remainder of my time on this side, working directly here on this arch and heel, which is where the pain is directly. So I'll spend a lot of time carrying it through all the way, adding a little bit of stretching, so I could do a little bit of dorsiflexion, external rotate, then internal rotate, some tractions as well, and just continue to focus. Of that connective tissue as like spider web when it's like trapped. So what we're trying to do is dissipate it and stretch it out. And that's it, our friends. That's what we have for you as part of your massage treatment after you've done the laser therapy with ortho laser. So we're excited to continue to bring you more of these short sessions in different areas of the body to show you how our treatments just work super well together. And thank you, and see you guys next time.